It's 2008. 15 years have passed since Clinton stood in that chamber holding his health security card. 15 years since Harry and Louise sat at that kitchen table. 15 years since the dream of universal health care collapsed into nothing. Nothing fundamental had changed. 47 million Americans were now uninsured. Not 40 million, 47 million. The number had actually gone up. Healthcare costs had more than doubled. Insurance premiums were crushing working families. People were still rationing medications, still choosing between groceries and prescriptions, still going bankrupt from medical bills. Everything that had driven Clinton to fight in 1993 was still there, just bigger, just worse, just more entrenched. And then, a young senator from Illinois stepped onto a stage in Denver, Colorado, and accepted the Democratic nomination for President of the United States. His name was Barack Obama, and he had watched what happened to Clinton. He had studied every mistake, every miscalculation, every political trap that had swallowed the last attempt whole. He wasn't going to make the same mistakes. At least, that was the plan. Obama came into office in January 2009 with enormous political capital. He had won decisively. Democrats controlled both the House and the Senate. The financial crisis had shattered public faith in the idea that markets could solve everything on their own. The political moment felt different from anything since 1965, and Obama moved fast. Within weeks of taking office, his team began working on what would become the Affordable Care Act, the most sweeping piece of healthcare legislation since Medicare and Medicaid had passed 44 years earlier. But Obama had learned from Clinton's mistakes. He wasn't going to build the plan in secret. He wasn't going to hand it to one person and lock the doors. He was going to work with Congress, let them shape it, let them own it. Committee hearings began. Senators and congresspeople from both sides were invited to participate. The process was slow, messy, frustrating, but it was public, transparent, and it was moving forward. For the first time in 15 years, universal coverage actually felt possible. But the opposition was already organizing. The same playbook that had worked against Truman, the same playbook that had worked against Clinton. It was being dusted off and updated for a new era. Town hall meetings across the country erupted into chaos during the summer of 2009. Organized groups showed up to shout down Democratic congresspeople trying to explain the plan to their constituents. People showed up carrying signs comparing Obama to Hitler, comparing the ACA to communism, claiming the plan included death panels, government bureaucrats who would decide which elderly Americans deserved to live and which ones would be left to die. It was completely false, entirely fabricated, a deliberate lie spread deliberately to terrify people. But it worked, just like Harry and Louise had worked, just like socialized medicine had worked against Truman. Fear, it turned out, never gets old as a political weapon. And then, in August 2009, something happened that genuinely threatened to derail everything. Senator Ted Kennedy, one of the longest-serving and most passionate advocates for universal health care in American history, died of brain cancer. The man who had spent 40 years fighting for this moment was gone, and his Senate seat in Massachusetts, a seat that Democrats had held for decades, was suddenly up for grabs in a special election. Republicans won it. Suddenly, Democrats had lost their filibuster-proof majority in the Senate. The 60 votes they needed to pass anything without Republican cooperation, gone. The entire effort teetered on the edge of collapse. And this is where Barack Obama showed exactly what kind of politician he was. Instead of retreating, instead of scaling back, instead of accepting a watered-down compromise that would have given him a political win without actually changing much, he pushed harder. His team found a procedural path forward. Budget reconciliation, a Senate process that only required 51 votes instead of 60. It was complicated. It was controversial. Republicans called it a corrupt abuse of power, which was interesting, given that Republicans had used the exact same procedure multiple times themselves. The legislative maneuvering that followed was some of the most intense in modern congressional history. Every Democratic vote was precious. Every senator had demands. Every congressman had concerns. Nebraska Senator Ben Nelson held out for special Medicaid funding for his state, a deal that critics immediately dubbed the Cornhusker kickback. Louisiana Senator Mary Landrieu secured $300 million in additional Medicaid funding, immediately dubbed the Louisiana Purchase. The deals were messy, they were uncomfortable. They looked exactly like the kind of Washington horse trading that makes ordinary Americans cynical about politics. But they were necessary, and Obama made them. On March 23, 2010, after 14 months of the most grueling legislative battle since the fight for Medicare itself, Barack Obama signed the Affordable Care Act into law. What exactly had passed? The ACA required insurance companies to cover people with pre-existing conditions. No more being denied coverage because you had cancer or diabetes or heart disease or any of the 1,000 things that had previously made you uninsurable. It allowed young adults to stay on their parents' insurance until age 26. It expanded Medicaid to cover millions of low-income Americans who had previously fallen through the cracks. It created insurance marketplaces, exchanges where individuals could shop for coverage and receive government subsidies based on their income. And it reduced the number of uninsured Americans by 20 million people. 20 million human beings who had been living without any safety net at all, now covered. It wasn't universal coverage. It wasn't the single-payer system that progressive advocates had dreamed of since Truman's day. But it was the largest expansion of American healthcare coverage since 1965. Harry Truman would have recognized it, not as everything he wanted, but as something real, something meaningful, something that moved the needle. But the fight, as always, was not over. Republicans immediately vowed to repeal it. Every single Republican in Congress had voted against it. Not one had crossed the aisle, and they were not done fighting. The ACA survived a Supreme Court challenge in 2012 when Chief Justice John Roberts, a conservative appointed by George W. Bush, cast the deciding vote to uphold the law. The decision sent shockwaves through Washington. Nobody had expected Roberts to side with the majority. And then, in 2016, everything changed again. Donald Trump ran for president promising to repeal and replace the Affordable Care Act on day one. It was one of his central campaign promises, and when he won, with Republicans controlling both chambers of Congress, it looked like the ACA was finally finished. Repeal bills were drafted, votes were scheduled. The entire architecture of the ACA, the pre-existing condition protections, the Medicaid expansion, the insurance subsidies, all of it was on the chopping block. And then, at 2 a.m. on July 28, 2017, a single senator walked onto the Senate floor. John McCain. He had been diagnosed with brain cancer just weeks earlier, the same disease that had killed Ted Kennedy. He had flown back to Washington against his doctor's advice, specifically to cast this vote. He looked at the Republican leadership, he looked at the bill, and he turned his thumb down. The repeal failed by a single vote. John McCain died 14 months later. So where does that leave us? The Affordable Care Act is still the law of the land today. Battered, amended, attacked, defended, but standing. Millions of Americans have coverage today who would not have had it before 2010. The uninsured rate in America has fallen to historic lows. Pre-existing condition protections have become so popular that even politicians who oppose the ACA rarely dare to attack them directly anymore. But the gaps remain. Millions are still uninsured. Drug costs are still crushing. Medical bankruptcy is still an American reality that virtually no other developed country experiences. The debate over what America owes its citizens when they get sick, the debate that Harry Truman started in 1945, is not resolved. It is not settled. It is not over. It has just changed shape again. And somewhere in the history of all of this, in the poorhouses and charity wards, in the lodge meetings and congressional hearings, in the coffee cup campaigns and town hall shouting matches, there is a single through line, a belief held stubbornly across generations, across defeats, across decades of setbacks and betrayals and near misses, that the health of a nation's people is worth fighting for. That the 68-year-old factory worker with no insurance and a surgical bill he can never pay, that he matters, that his life has value, that a country wealthy enough to put a man on the moon is wealthy enough to make sure its people can see a doctor. That fight began long before Harry Truman, and it continues today. And now, you know the whole story.